Hi everyone, I'm Dr. Omar. I'm gonna to show you the live demonstrations of the anomaly scan. First of all, we start with the head, the baby in breech presentations, and as we see the axial view of the head, we can get the lateral ventricles, where's the choroid plexus, perpendicular to both border. Then we go to get the cavum septum pellucidum, and this is a ventricular view and outer to outer, the biparietal diameter. Then we get the head circumference. Then we get back to the cerebellum as we see the fourth ventricle. As we see, the cerebellum is intact. And then it's very important to measure the nuchal fold. We can get the folks at this level and the cerebellum. Then we measure the nuchal fold. It should be less than 6 millimeters, and increasing of the nuchal fold is indicators for trisomies or cardiac failure or risk for fetal death. Then we measure the cisterna magna and go down to see the lips, the nostrils, upper and lower lips to exclude the cleft lip and palate. Then we go down to see the upper and lower mandible and to get the profile of the baby. Okay, this is the another view. It's a perfect view. This is the alveolar ridge, upper and lower. Yes, and then we get the sagittal view as we see the baby is swallowing, and we demonstrate the nasal bone and the profile of the baby to exclude the micrognathia. I show later in another videos that the brain structures in details, and in this view we can get the corpus callosum as we see the nasal bone. Then we go to the heart. The baby is in breech presentations, so the stomach will be on the right. Sorry, the stomach on the right of the screen. There is normal situs salutis, stomach on the left, heart on the left, aorta on the left. Then up, as we see, there is normal offsettings of the heart, normal contractility. This is the right ventricles. This is the left ventricles, which is forming the apex of the heart, long and smooth. We measuring the heart rate. We have to obtain 2 cycles from start to start. Then we can get the PR interval. As we see, it should be less than 130. The heart rate is 140, and this is the PR interval. We use it in the cardiac block or bradycardia. Then we obtain the color Doppler, decrease the PRF, duplicate the screen. As we see, there is no regurg. The septum, intraventricular septum, is intact. Yes, duplicate the screen to see in the color and in the grayscale. This is the LVOT, left ventricular outflow. There is no outlet VSD, nor perimembranous, nor muscular VSD. Then we adjust the box and increase the PRF to get the pulmonary veins. As we see, 1, 2, 3. It's not in the basic cardiac scan, but it's in advance, but I just to show you. This is the left again. This is the 3-vessel trachea view. Pulmonary, aorta, and then go up. We can see the left subclavian artery. This is the thymus, and right subclavian artery. Then the heart, this is the three vessels view is obligatory to obtain according to the ISIC guidelines. Then we get the sagittal view. This is the aortic arch, and we see the left subclavian artery, then the common carotid artery. The arch is very nice. Then we get the ductus venosus. It's very important to demonstrate the presence of the ductus venosus, and the pressure is very low. Then we go to, this is the pulmonary arch, and this is the ductal arch. Then the baby indeed in difficult positions with back posterior, so it's not easy to get these views. This is the ductus arteriosus. It's very important to measure. In some cases, there is closure, premature closure of it. This is the kidney, right and left. This is the axial view of the kidney. We can see the gallbladder. Then we demonstrate the normal incisions of the cord. I'm trying to get the kidney, but I did not get this view. Now, I'm trying to examine the upper and lower extremities. This is the radius and ulna. This is the humerus. The baby indeed is in fixed. There's no movement on the scan in the elbow, but I give the appointment, but there is a movement in the wrist, and I give to ensure that there is a movement in the next scan. We see the fingers in the right hand. It's very nice view. Again, as I've said before, the baby is in difficult position transversely and the back posterior. This is the other hand. It's very nice. This is the cord insertion. Okay, and we're trying to get the all of the measurement. This is the femur length. As we see, there is normal shape and normal echogenicity. And to be honest with you, it's not the right place or not the right place. The femur length should be horizontal. I will try to get probably. Okay, this is the bladder, and we have to see two arteries, and we demonstrate the two umbilical arteries and one vein. The baby is male. Yes. This is the anal sphincter. It's not a part of the normal scan, but I want to show you just. And this is the optimal view for the femur length, triangle shape, horizontal, less than 30 degree. Then we go to the lower limb to see the foot and to extrude the club foot. Yes, it's nice view. Now we get, yes, this is the soul. Perfect. This is another one. Again, the cold insertion. Then we try to get the, yes, this is the stomach. This is the abdominal circumference. We have to see two straight ribs, vertebral stomach, and the intrahepatic part of the umbilical vein. But I could not get in this view, but it's okay. Then go to this measurement to see on the 57th centile the growth. At the end of the scan, we get the placenta and we evaluate the placenta. It's away from the internal os posterior. Then we get the uterine artery, which is very important in the anomaly scan to predict the SGA and to see if there is any notching, to start the aspirin perpendicular from its origin and correct the angle less than 30. Then automated measurement to get the PI is 0.5. Then go to the left side, which is in this case very difficult to obtain, and the combined was normal. So I will show you in another videos the how to do in the anomaly scan properly, and if there is cases in it's not difficult positions as in this case. So thank you for your listening, and will see you in another videos, and have a lovely day.